student, the next topic of our Explain Why series is hypoxia causes vasoconstriction of pulmonary arteries but vasodilatation of the systemic arteries. Explain why. Hypoxia means lack of oxygen at the peripheral tissues. So this lack of oxygen will do two different things into different arteries. In pulmonary arteries, it will cause the vasoconstriction, whereas in the systemic arteries, it will cause vasodilatation. Why? The smooth muscle of the pulmonary arteries, they contain oxygen sensitive potassium channels which is similar to glomerulus cells of the carotid body. We have one previous video explaining why carotid bodies are insensitive to anemic hypoxia. There we have also given in flowchart how these carotid bodies, their oxygen sensitive potassium channels are acting or behaving in hypoxia. Similar type of channels are present in the smooth muscles of pulmonary arteries. So what they do when they are exposed to a lack of oxygen? So when the partial pressure of oxygen is less, so the potassium conductance of these cells will be, of these channels will be less. So potassium efflux will be less and intracellular potassium accumulation will be there. So intracellular positive charge accumulation means depolarization. That will cause the opening of voltage gated, mostly the L type of calcium channels and entry of calcium inside the cell. These calcium entry or efflux, actually it will cause so many things which will include the inhibition of nitric oxide. We know that nitric oxide is EDRF or endothelium derived relaxing factor. It helps in vasodilatation. So all these things, the activity of oxygen sensitive potassium channel as it is reduced, that will cause inhibition of nitric oxide or EDRF. Whereas the endothelium derived constricting factors, they will actually be stimulated by the intracellular calcium sensitization and will result in vasoconstriction in the pulmonary artery. This is in contrast to the systemic arteries. In the systemic arteries, you can see that they have ATP dependent potassium channel. In the pulmonary artery smooth muscle, we had the potassium oxygen sensitive potassium channel. Here also we have in the systemic artery the potassium channel, but that is ATP dependent. And when they are exposed to hypoxia, which will cause more and more potassium efflux through these channels, and that will ultimately lead to vasodilatation. So this explains that although hypoxia is same, but that will cause vasoconstriction in pulmonary arteries because there the oxygen sensitive potassium channel is working, which is closed and which is increasing the intracellular calcium, and so many vasoconstricting agents are activated. But in systemic arteries, the same hypoxia, but it will act upon the through the ATP sensitive potassium channel that will enhance the efflux of potassium and ultimately vasodilatation. So this well explains hypoxia causes vasoconstriction of pulmonary arteries but vasodilatation in systemic arteries. Thank you and subscribe.